Voice disorders are quite common and something we see a lot in the ENT clinics. To make a good diagnosis of a voice disorder, we need to take a good history from the patient, and this includes asking things about how often they get the hoarse voice or voice change, whether it's constant or whether it comes and goes, and how much it affects their life. Also things like their occupational history, so professional voice users and people who use their voice a lot will have a lot more problems with their voice potentially. Other things that really impact the voice are smoking and social voice use. We find a lot of people who do things like karaoke or enjoy singing, but haven't necessarily had singing training, often get worse problems with their voice than other people. When we've done a good history with the patient, the main thing we then like to do in the ENT clinic is use a little endoscope, which is a very small telescope that goes down the nose into the throat and lets us have a good look at the voice box. The advantage of this, we can see the voice box both in its static phase and also when people are talking and see how the voice box is working. We can see any lumps or bumps or any lesions on the voice box and see how well the vocal cords are approximating and see the surrounding areas. And this is probably the most important part of diagnosing voice problems. So when you come to the ENT clinic with a voice problem, you should get a good history taken from your consultant, and you should always have the little scope passed down your nose to have a really good look at the voice box. There are lots of different types of voice disorders. There's what we would call functional voice disorders, where the voice box itself looks normal, but just isn't working very well. And the commonest reason is the vocal cords don't meet in the middle. We get a big gap there and all the air escapes. The voice box then has to work harder, fatigues, and we get a hoarse voice. You can also get little lumps or bumps on the voice box. A lot of these are completely benign, things like vocal cord nodules, vocal cord polyps, little cysts that can be relatively easily treated. And of course, you can get voice box cancers. These are a lot rarer, tend to occur in smokers, but we can normally diagnose all of these with a simple endoscope in the ENT clinic. There are lots of causes of voice disorders, both mental and physical. Stress and excess voice use can just cause voice disorders. Again, this is relatively easy to look at in the clinic with the endoscope, and we really need to be able to differentiate whether it's a physical cause or a more functional cause. The treatment of voice disorders largely depends on the diagnosis. The functional causes, such as the phonatory gap, the gap between the vocal cords when people are speaking, are best treated with speech therapy, and we'll get the patients to see the speech therapist. They'll have a couple of sessions, go through vocal exercises and vocal hygiene, and make sure that we're using the voice correctly. If there are any lumps or bumps on the vocal cords, benign or malignant ones, then they can often be removed simply with surgery, and that's a small operation that we do under a general anaesthetic as a day case, normally without too many problems. Sometimes if the vocal cords, when we look down, isn't moving and we've got what we call a paralysed vocal cord, then we would need to do further investigations such as a CT scan to make sure there's nothing causing a problem with the nerve that supplies the voice box, which is called the recurrent laryngeal nerve. Once we've done that, that can often be helped with speech therapy again. And occasionally we can do a small operation to push the vocal cord across the middle so that the two cords meet to give a much better quality of voice. Voice disorders can affect people's quality of life quite markedly, especially if you're a professional voice user, so professions such as teachers or people who work in call centres who use their voice all the time can really struggle with voice problems. We like to therefore get these people through quickly and get them seen quickly in speech therapy, if that's what's required. A lot of people use their voice just as hobbies, so singing, and that again will affect people's quality of life. So voice disorders are very important to correctly diagnose and correctly treat. You can self-manage voice disorders, and often this is the case while waiting for the speech therapy appointments. The simple thing is to use your voice normally. Try not to force the voice and make it louder. Even a whisper can sometimes be more harmful than just a straightforward using the voice. So we would all suggest use the voice normally, avoid dry, dusty, smoky atmospheres, as they can all affect the voice. Stop smoking if you smoke. That's probably the most important thing. If there's underlying conditions such as gastroesophageal reflux or acid reflux, then get that treated either by your ENT surgeon or by your GP. And to reduce that will help the voice. Plenty of water. We'd always advise lots of good hydration, and that will help get a good environment for the voice box to work properly. The most important thing is to stop smoking.